Hello, everyone, and welcome to the AFib Quality Exchange call. My name is Audrey, and I will be your moderator today. Feel free to ask questions throughout the presentation by typing them in the Q&A section on the right side of your screen. The slides and links to the presentation will be sent out within 1 to 2 weeks of today's presentation. I will now turn over the presentation to Flannery, our Director for Quality.
Good morning or good afternoon, everyone. Thank you so much for joining us today for our AFib Quality Exchange. My name is Flannery O'Neill, and I am a Quality and Systems Improvement Director for Colorado and New Mexico, and I will be leading you through our Quality Exchange today. First up, I want to just acknowledge that it is Atrial Fibrillation Awareness Month. So many of you should have received some resources from IQVIA earlier this week, honoring and marking that this is Atrial Fibrillation Awareness Month, and we have some resources that are available to the public for you all to enjoy and for you to share among your hospital partners. There are some new podcasts that are available on detection, management, and treatment of atrial fibrillation. So that is a great way to learn more about atrial fibrillation. And then on stroke.org, we do have some resources and some support for patients who can seek out the root cause of cryptogenic stroke. And this will include the implementation of the 2019 atrial fibrillation guidelines, which highlight the new implications for detection of potential AFib in cryptogenic stroke patients. And then another great resource is on myafibexperience.org, and that is more information about what you can do for your AFib patients. Learning more about patient preferences, multidisciplinary approaches to treating atrial fibrillation by using some of the resources that are available on My AFib Experience. So jumping into the agenda for today, I want to cover just a brief overview of Get With the Guidelines Atrial Fibrillation. I know you all are using the module day in and day out, but just wanted to do an overview and look at the measures that we are looking at with the AFib module. Then we'll review the quarterly data days. You all should have received your data days quarterly data reports from your director. If you did not receive that or do not know who your director is, you can email swaquality@heart.org, and we will get you connected with your director and make sure that you get that information. We'll cover important upcoming dates, educational opportunities, and other announcements. So first, just a reminder, atrial fibrillation and the implications for stroke risk. The average person living with AFib is 5 times more likely to suffer a stroke than someone with a regular heartbeat. I think that's just an important reminder of why we are doing the work that we're doing with AFib quality improvement. Atrial fibrillation currently impacts 2.7 million to 6.1 million individuals in the U.S., and that's projected to increase to 12.1 million by 2030. The risk of stroke, if untreated, is between 3 and 12% per year, and those strokes due to AFib have a higher severity, disability, and mortality. So we really want to look at those therapies that can prevent the stroke, in atrial fibrillation patients. So just diving into our brief overview. So when we look at atrial fibrillation management, we are really looking at anticoagulation, rate control, and rhythm control. The goals of Get With the Guidelines atrial fibrillation include improving the quality of care for patients with atrial fibrillation, and that includes improving that adherence to anticoagulation guidelines for prevention of stroke, improving the patient adherence to that anticoagulation therapy through the education, improving heart rate control in patients, and ensuring quality drug therapy in those patients. And we're also looking to improve the outcomes for AFib patients by ensuring adherence to treatment of their comorbid conditions. So for those patients with coronary artery disease, we're looking at beta blocker and statin therapy. In our heart failure patients, we're looking at the ACE and ARB and beta blockers, and then smoking cessation counseling and therapy for patients who are using tobacco products. And as a reminder, an advisory working group of multidisciplinary teams, including electrophysiology, cardiology, hematology, neurology, advanced practice nursing, and pharmacy, work collaboratively to translate the evidence-based medicine into clinical practice. So we do have guidelines, of course, that are supporting the work with Get With the Guidelines, atrial fibrillation. We have our 2014 guidelines and then the 2019 focus update. So when you receive these slides, we have a link so that you have direct access to those that focused update. As a reminder, our patient entry criteria for the module, we're including patients with a principal diagnosis of atrial fibrillation who have been admitted to your hospital as an inpatient. Patients with a principal diagnosis of atrial flutter also admitted as inpatient. And you are encouraged to enter patients with a secondary diagnosis of atrial fibrillation or atrial flutter. And then optionally, you can choose to enter patients that are seen in observation and not admitted as inpatient. And then we are excluding patients evaluated, treated, and discharged from the emergency department with no inpatient admission or admission to observation status. And then we are also excluding those patients that are less than 18 years of age. And if at any time during this presentation you have questions, please just type those into the chat box and Audrey will alert me to those questions. Now let's take a look at the measures that we are looking at for our atrial fibrillation module. For the achievement measures, we are looking at an ACE or an ARB or ARNI prescribed prior to discharge. We are looking at the CHADS-2-VASc score documented prior to discharge, beta blocker prescribed prior to discharge when appropriate, FDA-approved anticoagulation prescribed prior to discharge, PT-INR, planned follow-up documented prior to discharge for warfarin treatment, and statin at discharge in patients with CAD, stroke, peripheral vascular disease, or diabetes. So those are the achievement measures. And then we have a variety of quality measures that we are also looking at. So we're looking at aldosterone antagonists at discharge, anticoagulation therapy education, atrial fibrillation patient education, discharge heart rate less than 110 beats per minute, smoking cessation, warfarin at discharge for valvular atrial fibrillation or atrial flutter patients, inappropriate prescription of antiarrhythmic drugs to patients with permanent atrial fibrillation prior to discharge for rhythm control. And then we continue on with our quality measures. So we're looking at inappropriate prescription of defilotide or sotalol prior to discharge in patients with atrial fibrillation and end stage, inappropriate prescription of a direct thrombin or factor X inhibitor prior to discharge in patients with atrial fibrillation with a mechanical heart valve, also inappropriate prescription of the direct thrombin and factor X inhibitors prior to discharge in patients with AFib and end-stage kidney disease or on dialysis, inappropriate prescription of antiplatelet or oral anticoagulation therapy prior to discharge for patients who do not have coronary artery disease or vascular disease. Inappropriate prescription of calcium channel antagonists prior to discharge with patients within a reduced ejection fraction. And patients who underwent atrial fibrillation catheter ablation who were not treated with anticoagulation therapy during or after a procedure. And then we have a variety of reporting measures as well. Antiarrhythmic at discharge, anticoagulation during hospitalization, prescription of aspirin or antiplatelet therapy in patients with atrial fibrillation and no evidence of coronary artery disease or vascular disease, appropriate prescription of antiplatelet and oral anticoagulation therapy prior to discharge in patients with atrial fibrillation and coronary artery and or vascular disease, aspirin at discharge, QT interval measured after initiation or increase and sustained treatment with dofilitide or sotalol, screening for obstructive sleep apnea, and discharge heart rate less than 80 beats per minute, and digoxin at discharge. And then finally, we have a few descriptive measures that you all are entering as well, and that's age, diagnosis, gender, length of stay, and race. Just as a reminder, your participation in the atrial fibrillation module also allows you the opportunity for hospital recognition. So when we looked at those achievement measures, we are asking for an 85% or greater compliance with those achievement measures in order to be eligible for our recognition. First level of recognition is the bronze level, and that is an 85% or higher compliance on the achievement measures for 90 consecutive days. Then you would be eligible for a silver recognition, and that is 1 calendar year of 85% or higher compliance on the achievement measures. And then eligibility for gold is with 2 calendar years worth of data and compliance with those measures at 85% or higher. As part of that recognition, you would also be recognized at our national events, including the scientific sessions that is coming up in November. You're also listed in advertisements that appear annually in circulation and the Best Hospital issue of the U.S. News and World Report. Hospitals that are provided, you're also provided with a customizable marketing materials that you can use to announce your achievements locally. Just some highlights of our patient management tool. That tool launched in June of 2013, and that includes a comprehensive form covering arrival, admission, in-hospital, discharge, and follow-up care. And you do have those error checking tools to ensure that your data is complete and accurate. The tool includes skip logic and auto-population to streamline your data collection. And there are 30 compliance and demographic measures in real-time reporting that's available for you. And just a reminder, in case you weren't aware, you are able to auto-populate your records from if your hospital is participating in either the heart failure or the stroke modules. You can auto-populate 120 data elements over from the heart failure module and about 50 data elements from the stroke module. So that will help cut down on the time that it takes to enter those patients into the system. So now we'll jump into our quarterly data days. As you all know, on a quarterly basis, your local director reaches out to you to give you a data snapshot of how you're doing for the previous quarters in the year. And we really do that because we know that you are very busy and you may not always have the opportunity to review your data and look at your reports and see how you're doing across the calendar year. And so that's why we provide these quarterly data reports. And like I mentioned before, we sent those emails out last week. So if you did not receive that email, it may have gone to another contact or got lost in your junk mail. So just let us know. Reach out to your director directly or to swaquality@heart.org, and we will make sure that you get that report. So that detailed email has each measure highlighted in either red or green to indicate whether you're meeting or not meeting that measure. And then if there are fallouts on your achievement measures, then we will also provide you a fallout report in an Excel format for you to review those records. And we also indicate when your most recent discharge date was so that you can see where you are in terms of keeping your patient management tool up to date. And just a note, we note this on the email, but also a note for you as well. If you're familiar with some of our other modules, we do not have quality awards like we do for stroke and heart failure and the other modules. A few important dates for you all to keep in mind. So as I mentioned before, U.S. News and World Report is one of the great ways that we are recognizing our award-winning hospitals. That is available online and will also be available in the print version in the coming weeks. So keep an eye out for that. And we've included the link so that you can see the online version of that. We did just send out your Q2 snapshot reports. Our American Heart Association Scientific Sessions, that will be hosted November 16th through the 18th. And on the 16th, we have a Quality Showcase Showdown. So that is going to be a poster opportunity, time for recognition and networking. That is going to take place from 7 to 9 at the Philadelphia Marriott downtown. Then November, the end of November 2019, your Q3 data is due to be abstracted into the system. And then the end of February 2020 is going to be when your Q4 data is due in the system. And the data that we look at, or that is due by the end of February, is what we're looking at when we are looking at recognition. So you need to have all of your data in by then so that we can review it and check to see your eligibility for recognition for 2020. And here's just an informational flyer about the quality showcase that we are having in Philadelphia. We would love for you to bring posters to this event, and there's going to be a poster competition during that time. So if you would like more information about that, again, reach out to your director or reach out to us at swaquality@heart.org. And I just wanted to highlight a few educational opportunities that we have for you. There are a great amount of atrial fibrillation webinars that are available on our website. You'll see the link down here at the bottom, but if you go to our quality improvement section of heart.org, you will be able to find links to these educational opportunities. Some of the topics include atrial fibrillation and cardioembolic stroke, get with the guidelines establishing an atrial fibrillation clinic, clinical performance and quality measures for adults with atrial fibrillation, a left atrial appendage closure for stroke prevention, and targeting a new area of AFib care. Another option is the virtual atrial fibrillation conference. That's an enduring educational feature. This activity focuses on AFib education resources and providing insight into common AFib treatment barriers. Best practices will be reviewed to help hospitals lacking AFib programs to learn about creating administrative buy-in, setting up an AFib clinic, and creating a multidisciplinary team to better treat your patients and improve outcomes. Adherence to guideline-directed stroke prevention therapy for atrial fibrillation is achievable. First results from Get With the Guideline Atrial Fibrillation. And this is a great reminder that not only does the data that you're entering help support your quality improvement program at your local hospital, but it also helps to further the knowledge across the country and the science across the country for the treatment of atrial fibrillation. So in this educational event, you're discussing the recent findings in the publication Adherence to Guideline-Directed Stroke Prevention Therapy for Atrial Fibrillation Patients. So the link to that, again, is also available at the bottom of this slide. And then finally, many of you probably received an email notice that there was a heart failure and atrial fibrillation virtual summit just a few weeks ago. That was a live event, but will also be available for enduring viewing and credit in the coming weeks. So keep an eye out for that. And here's just a reminder of some of the research publications that are available to you. There are, going back to 2008 through 2019, several publications that were funded and guided through the work that we are doing with the American Heart Association. So in 2019, we have Adherence to Guideline-Directed Stroke Prevention Therapy for Atrial Fibrillation is Achievable. That is the some of the education that we were just discussing a few slides ago. The use of oral anticoagulation in eligible patients discharged with heart failure and atrial fibrillation. Real-world effectiveness of warfarin among ischemic stroke patients with atrial fibrillation. Get With the Guidelines AFib, Novel Quality Improvement Registry for hospitalized patients. And then from 2013, the American Heart Association Council on Cardiovascular and Stroke Nursing. And then quality of care for atrial fibrillation among patients hospitalized with heart failure. And then finally, the last article is differential use of warfarin for secondary stroke prevention in patients with various types of atrial fibrillation. And just some updates for you. Just a reminder that there may be users that have access or login information that is not an up-to-date list of the staff at your hospital. So often there can be users who have left the organization or are a different role in the organization and they still have access to the PMT. So when you have a moment, log into your patient management tool, take a look at the users who have access to the PMT, and just let us know if there are any individuals that no longer need access to your, whether it's your atrial fibrillation or other modules. If you don't know who has access, you're welcome to reach out to your QSI director and they can help you with that as well. And as a reminder, if you don't know who that is, swaquality@heart.org and we can help you out. We are also endeavoring to do public reporting of Get With the Guidelines performance. Enrollment in Get With the Guidelines demonstrates your hospital's commitment towards improving patient care. And now we are allowing your participating hospitals to publicly report their performance achievement measures. It is your decision whether to opt in or opt out of this public reporting. if you do nothing, the default is that you will be opted out. The initial opt-in, opt-out period has just closed, but there will be another opportunity later this fall to opt in. This is a great opportunity for improved customer awareness of their healthcare options and patient care decisions. There's potential participation in various national hospital rankings, for example, the U.S. News World Report. You may be able to get credit from your health plans for voluntary public reporting, and this may help you meet hospital accreditation requirements. If you have questions about that, please let us know. And that wraps up our quality session for today. If you have questions, please put those in the chat box. And again, we appreciate we appreciate everything that you do for quality improvement for your atrial fibrillation patients, and we are here to support you. So just please let us know what your needs are so that we can help you with that. And I will turn it back over to Audrey.
Perfect. Well, we don't have any questions, but I just wanted to say thank you everyone who joined, and again that the slides will be sent out to you within 1 to 2 weeks of this presentation. And again, if you have any questions, feel free to reach out to Flannery, and have a wonderful day. Bye.